Hi, I'm Dr. Fred Schroeder at Schroeder Cosmetic and Family Dentistry. I'd like to speak to you real quickly about options that you have in replacing missing teeth. In another short video on our site here, we have the reasons you want to replace missing teeth. Okay, number one is a removable partial denture. The advantages: it's inexpensive, quick to make, very little chair time. The disadvantages are that it's something you take in and out. It is aesthetically not as good as some other options because the clasps can be sometimes seen, it sometimes gets food under it, it can be gaggy and irritating to the tongue. People often bring these back and ask about the other two options because they're a better choice for your comfort, and this is something that we also want to factor in as to how you replace missing teeth. Second option is bridge work. In order to bridge a missing tooth, you have to have a good, solid, healthy tooth on either side. Just like the bridge that goes over a river, you have each end anchored and then a portion over the area that is without function or without a tooth. The advantage to this is sometimes it's more frequently covered by insurance, so cost is perhaps better covered with your particular plan. The other advantage is that it's been done for 100 years. This is not new technology, and some of the newer materials in bridge work, all porcelain crowns and all porcelain bridges, are aesthetically gorgeous. This stays in the mouth, very comfortable. However, it is more difficult to clean. You cannot floss in between the teeth involved. You have to thread up underneath in order to keep the tissue healthy. And you have to appreciate that not everybody has the dexterity or the time or the motivation. Getting people to floss has always been a challenge in our office. The third option are dental implants. These have been around for half a century, although more recently, in the last 20 years, they've become much more predictable. We can put in a small root replacement piece of titanium. It sounds worse than it is. The worst part about implants is the word implant. This is a tiny, tiny piece of prosthetic that has no other job than to sit there. It's not like a hip or a knee replacement that has to function. All it has to do is lock and stay in place. Then we build on the tooth, put it into function, put an aesthetic crown on it, and you can floss down in between, and generally, very, very quickly, forget that it's even there. Thank you.